And welcome. So, evaluating the specificity or selectivity of analytical procedure is one of the very important performance characteristic according to validation of analytical procedures guideline Q2R2. And how one can validate or evaluate the specificity or selectivity? There are three different ways given into the Q2R2. The first one is evaluating the interference. The second one is again same on the comparison of the result for orthogonal procedures. And the third one is the technology specific inherent justification. So as a part of this video, we will try to understand how to use orthogonal procedure to evaluate specificity or selectivity. So what is meant by specificity or selectivity? Let us try to understand this term first before we move on to the procedural part. So specificity and selectivity are both terms to describe the extent to which other substances interfere with the determination of an analyte according to a given analytical procedure. That means if you are analyzing, let us say, a tell me certain assay by using an HPLC procedure. Now there may be some another sample components present. It could be degradants, it could be impurities, it could be diluent, it could be excipients present into a tell me certain tablet. So how this sample matrix, how this excipient impurities are going to interfere while quantifying the tell me certain, let's say, is something called as the specificity. So specificity is typically used to describe the ultimate state measuring unequivocally a desired analyte. Now, if you look into the definition of separate term, that is the specificity and selectivity. What are they actually? So the specificity is typically used to describe the ultimate state, and this is the definition given in the current guideline ICH Q2R2. It is called as the ultimate state, measuring unequivocally a desired analyte. What is meant by ultimate state? That means whatever analytical procedure you are claiming as a specific for your analyte, that indicates that there is no going to be any interference while quantification of that particular analyte. Means your analytical procedure is absolutely specific with respect to the analyte quantification. There is no excipient, there is no impurity, there is no degradant can interfere with the interested analyte. That is the definition of specificity. What is the definition of selectivity? So selectivity is a relative term. It is what? A relative term to describe the extent to which particular analyte in the mixture or matrices can be measured without interference from other components with similar behavior. That indicates that this is a relative term. Means what? There may be some possible interference from the sample matrices, but which is acceptable, which is below the acceptable level. That is called as the selectivity. So which term is more practical, whether specific or selective? So selective term is more practical, quite easily achievable, and not the specific term. So how specificity selectivity can be proved, and as we discussed at the beginning, there are three ways of proving the specificity. The first one is absence of interference. The second is orthogonal procedure comparison. And the third one is technology inherent justification. As a part of this video, we will try to understand how orthogonal procedure comparison can be used for evaluating the specificity or selectivity of your analytical procedure. Now, before we move on to the procedural part, let us understand what is meant by an orthogonal method. Now, these are the methods, right? These are the methods that are independent of each other and they operate on a different analytical principles. Let us say you have an HPLC method, and if you compare this method with a gas chromatography method, now these methods are operate on a totally different principles, isn't it? And hence they can be called as a orthogonal method for each other. If two methods based on different principles agrees on the result, it provides a stronger evidence that the results are accurate because their separation mechanism can be different, their detection mechanism can be different. In spite of having all those differences, they give the same result, so they must be accurate. And hence, by comparing the results of the analyte measurement from two orthogonal methods, one can confirm that the methods are indeed specific or selective. And this becomes a very solid ground to claim that these two methods must be specific and selective, or specific or selective. Let us now understand how to use orthogonal procedure to evaluate specificity or selectivity. The first important point is what? The choice of method. So how you are going to decide onto the orthogonal method for comparing the result? The choice of orthogonal method should be based on chemical, physical properties of analyte and potential interference possible. Chemical and physical properties of the analyte should be considered. Along with that, you must also consider what is going to be the potential interference. Means whatever orthogonal method I am going to select, that method must be suitable for analyzing my analyte in terms of understanding its physical and chemical properties, and also what is possible interference going to be, and whether that orthogonal method has the capacity to selectively or specifically avoid that interference, potential interference. So this is a very important point while selecting your orthogonal test procedure. For example, I have the HPLC method in the hand, and if I select potentiometry as orthogonal method, can it work? Absolutely not, because potentiometry method basically is not going to be a specific or selective, isn't it? But if I think about an MS or gas chromatography, that can be a better choice for HPLC method. Select appropriate methods. So choose different analytical techniques that are based on different principles. For example, if your primary method is SPLC, you might select GC or MS as a orthogonal method. Analysis. Perform the analysis using a validated orthogonal method. Now, this is a very important term. Whatever orthogonal method you are going to select, that method must be validated. Means that method must be proven to be specific first and selective first. That method must be proved to be precise and accurate first. Otherwise, how you are going to uh, confirm, or how you are going to consider the result generated by the so-called orthogonal method, right? So instead of, without having the validation, you cannot confirm the suitability of the orthogonal method's result. So that method must be first validated. So analyze the sample and then compare the result generated by your uh, method and the orthogonal method. And by comparing the results, you can understand whether results are comparable or not. Maybe in terms of their percent RSG for the repetitive measurements, or maybe in terms of understanding the interference with respect to the given acceptance criteria. So this is all about how you can use orthogonal procedure comparison to evaluate specificity or selectivity of your method. Thank you so much, and let me know what is your opinion on this discussion.